Thank you so much, Dr. Manish Mahajan, for organizing this event on multiple sclerosis and actually bringing out some of the great aspects on how patients can deal with this, what are the advancements coming up, and connecting with patients, their families, and the advanced doctors, super specialty doctors. My first question to you is, what is that motivation behind this, that you are organizing this awareness program every year?
Okay, so it's actually the people with MS, and I have been caring for people with MS and participating in the management of people with MS during my neurology training, and I would owe it to my teachers, my gurus, and then obviously you develop an area of interest when you, because neurology is a broad subject, and we definitely, people focus on areas where they can develop an expertise and they can learn more in depth so that they can offer the same expertise to people suffering from that particular disorder. So multiple sclerosis and demyelination, if we talk about the broad speciality, where neuroimmunology is one broad speciality. So immune mediated disorders of the central nervous system, they are one of the most treatable disorders of neurology. So that is something where I felt, because in the yester era, neurology was taken as a science where labeling or getting up to the diagnosis level was sufficient, and people used to feel that yes, they have done a lot, that they had diagnosed a particular entity. But when it came to treatment, they had very few options. So as the science has advanced, and that has helped us actually offering, giving some treatment options to our people, and we have a lot of disorders where we now have number of treatment options like stroke, like epilepsy. But in demyelination, especially the acquired demyelination, the way which multiple sclerosis is one of the acquired demyelination disorder, which is an immune mediated inflammation. So with the advent and with the introduction of many MS specific disease modifying agents which act on the, and with the more understanding, so it's the one of the reasons that I developed an interest in this era. As far as commemorating the multiple sclerosis day is concerned, there is, I think, when you develop an interest, when you see such patients more and in depth, you tend to go beyond a certain point. So this aspect is not only the medical management, which we can definitely offer in any MS clinic, and even in routine in neurology clinics also, all of my neurology colleagues and friends would be doing it. We first step towards it was developing an MS, dedicated MS clinic. So where not only you are the person who is responsible for the care of the people with MS, it was the MS nurse. So we got some we nurses who got trained in not only evaluation but also administration of specific treatments. Then the next step further was going beyond and understanding the problems which people with MS actually face. So they are, and if we talk about the medical management, it's just a small proportion of what they actually face, and giving solution to that limits the help actually you can give them. So I thought of going beyond this. The first and foremost reason of commemorating World MS Day is to show our solidarity, our neurology fraternity, support to the cause of people with MS. So that's the major driving factor, because they are the reason, people with MS are the reason we have gathered together today over here, and we have been doing it every year. No other major driving force. They are the people with MS, the faith they show in you, and the number of years they are with you, that only pushes you further and motivates you to do it next time again and in a much better way and more all-inclusive campaigns.
That's great. So the motivation behind this we can all see, and just like you said, it is all in all for the patients of MS, and that keeps you going, that keeps you motivating to do more and more such kind of things. We all heard about the treatment advancements and stuff, but the newer aspect I would like to talk about, what do you think should, since you are connected with MS patients every day, you deal with them, you treat them, you are part of their life, so what do you think policy should be added for them, that their life could be made a little easier, they can lead a normal life with the thing they have diagnosed with, and the challenges will be little less?
Yeah, so I think as far as the medical expertise is concerned, we have lot of well qualified, well trained, and experienced neurologists across the country. But what I personally feel, and one of the charters of my foundation, People for People with MS Foundation, is, and in association with and whole of the Indian Academy of Neurology, actually advocates, is the two important policy matter change. One is the public support mechanisms, which not only include the transportation, that means the public transport should be more conducive, more comfortable for people with different abilities, and whenever, and especially with people who acquire it, because they may be continuing with their employment, their ambulation, their mobility across the community. So if our buses are not equipped accordingly, if our public places are not wheelchair friendly, if there are other lot of places which need to be catered to the special needs, people who need aids to walk, and the another aspect is not only transportation. It's not restricted to policy matter changes to the transportation alone, it is to the rehabilitation needs also. So it was rightly in one of our Indian Academy of Neurology national conference, we held a public and policy awareness campaign also, which was called as Neurons Ki Awaaz, and we did address this issue, that the whole Indian Academy of Neurology rose up to the occasion and submitted a white paper to the Niti Aayog about the need for change in the public transport system to be more friendly, the places around that they should be emphasized to have such support for people with disabilities. Secondly, rehabilitation facilities have to be created for these people, so that they are more available, they are more accessible, and they are more affordable. So availability, accessibility, and affordability, all three aspects. And when it comes to affordability, if I talk about the next important aspect which we as a fraternity want to advocate, is the policy change from the third party assurance, where I think a person with MS gets the disease in an early age. If you talk about the current scenario, most of the people will, if they have an insurance in the background, their TPA on, already on, many of them still can be denied a facility or a treatment modality just for the sake that it's an oral drug, they will not get it. And till now we have discussed that it's a chronic disease, so they need treatment more or so lifelong. So they need that support from their treatment TPAs for a longer period of time, and not only restricted to the hospitalization, it has to be for the oral disease modifying agents as well. So we need to come up with a policy change. We need to sit again, look at such type of chronic disorders where people need such support, and we need to change that. Not only people who are previously insured, the newly diagnosed people can opt for a maybe at a different premium, but they can still be offered, they can still avail the option of a new insurance policy, so that when the need arises, they can at least, just because of finances, they should not be devoid of the treatment. Because it's in our country as of now, most of the people pay from their own pocket for the healthcare. So that's the big public health issue, I would say. So multiple sclerosis, as we understood it today, that as it was thought to be very less prevalent in India, it's totally wrong. We have a huge and we are always boasting about our young population. So that means we have more population who can, even if our proportion of population is less, we will definitely have more numbers from the West as compared to the West. So we need to have certain definitive policies in place, and whole of the Indian Academy of Neurology, whole of neurology fraternity have been always vocal about it, and still they are vocal about it, that we need a policy change. So as an individual, as a MS physician, so again, it's a corollary to what we talk, that it's the motivation, it's the reason that we need to stand for people with MS. Thank you.
Thank you so much, sir, for sharing your insights and experience and your thoughts that what should come in and how we can improve it more. But with your words and your thoughts, we know that this improvement will be there. This will be a better treatment, options will be there. Doctors like you are there to help people with MS, and thank you so much for being there for the people and for everyone else. Thanks a lot.